How to beat depression and anxiety without medicine. 4 surprising ways. For any normal person, there are great days where we feel that we are on top of the world, average days which are neither dull nor exciting, and there are those days filled with sadness, anger, guilt, remorse, and a plethora of other negative emotions. When negative emotions begin to consume us for long spells, we can get anxious or fall into depression. As opposed to the popular belief that depression is a response to normal grief or is a symptom of laziness, depression is a medical condition. Symptoms of depression include having an irritable mood, experiencing sleep difficulties, losing interest in activities you used to enjoy, and having a low self-image. It is also common for people with depression to change their routine in self-care, for example, not showering anymore, and changes in their appetite, i.e., eating too much or too little. Other symptoms include experiencing severe panic attacks, self-harm, and suicidal ideation. Medical attention may be necessary to manage anxiety and depression, especially when it has reached the extent of self-harm and suicidal ideation. Yet, there are particular behaviours that a person can adopt to ease and manage symptoms of anxiety and depression. If you struggle with anxiety and/or depression, this tutorial is meant for you. In this video, we're going to offer you 4 surprising ways of beating anxiety and depression naturally without using medication. Welcome to Worlds for All. Please remember to like, share and subscribe to our channel to help us grow. If you struggle with anxiety and/or depression, this video is meant for you. It is worth noting that the coping skills included in this video are supported by scientific research, and even therapists and psychiatrists frequently recommend these skills as part of treatment. In case you are taking antidepressant medications, do not suddenly go off your prescribed medications without first talking to your medical provider. Number 1. Physical activity. Numerous studies have proved that physical activity is effective in treating anxiety and depression. Some studies have even demonstrated that exercise can provide similar anxiety-reducing benefits as medication. These effects are strongest when you make exercise a part of your daily routine. Physical activity is effective in managing anxiety and depression since it lowers stress hormones such as cortisol and triggers the release of endorphins that generate positive feelings. In addition, exercise improves the quality of your sleep. Sleep is correlated to your well-being. Loss of sleep or poor sleep can increase anxiety and depression. Anxiety and depression, on the other hand, exacerbate sleep. Physical activity also boosts your confidence. Anxiety and depression significantly reduce your self-esteem, resulting in having a low self-image. Engaging in exercises counteracts the low self-image, making you feel more confident and competent. Physical activity comes in many forms. Find one that you enjoy and that you can fit into your lifestyle. From simple activities such as walking, jogging, and dancing to others that are more engaging such as cycling, strength training, and intramural sports. Choose a sport that you enjoy. We recommend that you engage in moderate exercise at least 3 to 5 times a week for a minimum of 30 minutes. Number 2. Maintain a healthy diet. In addition to engaging in physical activity, maintaining a healthy diet can help manage the symptoms of anxiety and depression. Pay attention to the type of food and drink that you take, since food has an influence on your mood. When it comes to eating, moderation is key. You don't have to entirely get rid of fat diets, but frequently binging on junk food, carbs and energy drinks only leads to heightened levels of anxiety and depression. What is a healthy diet? A healthy diet comprises of a balanced diet that includes carbohydrates, proteins and vitamins. You should also drink enough water while limiting or avoiding processed sugar, alcohol and caffeine. As we had mentioned earlier, caffeine and alcohol disrupt sleep. We also recommend following a diet rich in whole grains, vegetables and fruit rather than eating processed food that is high in simple carbohydrates. processed food also has little nutritional value. Specific foods that reduce anxiety and depression include foods that are rich in magnesium, such as leafy greens, e.g. spinach, whole grains, nuts, legumes, and seeds. Foods that are rich in zinc, such as beans, nuts, seeds, legumes, and nuts. Foods that are rich in B vitamins, such as almonds and avocado. And probiotic-rich foods that are good for your gut health. Antioxidants can also help combat anxiety and depression. These are simple chemicals found in the body and in certain foods, and that stop the process of oxidation in the body. Examples of foods that are high in antioxidants include beans, black beans, pinto beans, kidney beans, fruits, cherries, apples, plums, nuts, walnuts, pecans, berries, cranberries, blueberries, strawberries, raspberries, blackberries. Vegetables, spinach, broccoli, kale, beetroots, artichokes, and spices, turmeric, ginger. Separate from eating a healthy diet, it is also important to eat regular meals. Do not skip meals, since this can lead to a drop of sugar and this can exacerbate your anxiety. Number 3, meditation and mindfulness. As an ancient practice, meditation has been found to contribute positively to a person's mental health and well-being. And what's more, you don't need to be a Buddhist to benefit from the practice of mindfulness meditation. The goal of mindfulness meditation is to remain an observer and notice the different experiences of being in the present moment. Meditation involves finding a quiet place, sitting and focusing on your breath. Pay attention to your inner and outer breath as you observe a myriad of bodily sensations, thoughts, emotions, memories, and noise will arise. On your part, stay still and observe them as they arise and pass without resisting or entangling yourself in them. Findings of various research studies have shown that mindfulness meditation can address negative thinking that leads to anxiety. In addition, mindfulness can improve one's self-esteem and reduce the symptoms of anxiety disorders. Practicing mindfulness meditation regularly allows you to notice and acknowledge the anxious thoughts that normally overwhelm you. Noticing them allows you to come back to the present moment. Over time, these thoughts can be less intense and they can pass quickly too. To beginners, the practice of mindfulness can feel unnatural. However, with some commitment, mindfulness can be really effective in boosting your mental health. Number 4, psychotherapy. Now, there are a myriad of different models or modalities, as is known in the profession, of different types of counselling styles and therapy styles, and I would recommend that you do your own research online, but also try to contact a number of therapists who are practicing this particular model to find out more about their modality. Anxiety and depression can make you feel helpless, alone and distraught. Remember that you are not alone. In addition to therapy, there are many ways of fighting anxiety and depression. Talking to someone, like a professional therapist or counsellor. Changing your behaviour, including your lifestyle and way of thinking, are natural depression treatments. It is certainly possible to treat anxiety and depression without medication. Try out these 4 surprising methods we have listed above to help you cope and live a happier and more productive life. Remember to also focus on healthy relationships and form friendships that lift you up. It's easy to isolate yourself when you have anxiety and/or depression. However, find a balance since your condition may get worse when isolated. Try to maintain a regular sleep schedule. A good sleep cycle can also help you manage your anxiety and depression. We recommend that you start working on yourself immediately with these 4 methods. Do not practice all the methods at once. Start with 1 or 2 and gradually incorporate them into your routine. It's normal in the beginning not to be motivated or to stay motivated to do any of them. This is because anxiety and depression zap your energy. With this in mind, know that it is normal to feel unmotivated in the beginning, but still fight this resistance and start with small steps. We would love to hear about your experiences with anxiety and depression. Have you ever thought of managing your anxiety and depression without medication? But of course, talking to your doctor first about this. What are your thoughts? Feel free to leave us a comment on your experiences. Thank you for watching this video. Please remember to like, share and subscribe to our channel.